what happened is that medications became used for diabetes. And the medications for diabetes can make you get fat, can cause obesity. And then the obesity makes the diabetes worse through something called insulin resistance. So once you start down the medication pathway for managing diabetes, you're always going to have diabetes, which is good for the drug industry, good for the drug companies, not so good for the individual.
Hey guys, today we have a very special guest with us. He is Dr. Eric Westman. Dr. Eric Westman is a true pioneer in the world of low-carb medicine. He has been involved for over 20 years in this area, having started basically by reaching out to Dr. Atkins himself. Dr. Eric is board certified in internal medicine and obesity medicine, and he's the founder of the Duke Lifestyle and Medicine Clinic. He also has a master's degree in clinical research with over 90 peer-reviewed publications. Dr. Eric is an expert in combining the knowledge from anecdotal standpoint, research, and clinical standpoint to further this movement of low-carb diets. Also, Dr. Eric has helped patients at his Keto Medicine Clinic at Duke University to lose over 26,000 pounds and reverse conditions like type 2 diabetes, PCOS, high blood pressure, and more. He's also the author of a must-read book called End Your Carb Confusion, which helps us to understand all this diet stuff in a simple way. I'm very happy to invite Dr. Eric Westman to the show. Thanks, Eric, for coming to the show.
Thank you for having me.
Yeah. Eric, before we go into the first few questions, can you say where can people connect with you?
Sure. Well, I'm in several places on the internet. Now, I have a company that is called Adapt Your Life, ADAPTYOURLIFE. So you can find information at adaptyourlife.com. And we just opened a new keto masterclass that's digital and available worldwide at adaptyourlifeacademy.com.
Thank you so much, Eric. Eric, my first question is that before 20 years, nobody really knew what is a keto or low-carb diet. Then did you face any challenges like when you started doing research on this diet?
Oh, yes. Now, this is going back a long time, but you have to understand some of the same concerns are there today, not for me, but for other doctors or people who don't understand or don't know keto diets. The first diet study that we did, the hospital director wanted to shut down the study. So it turns out a dietitian who thought the diet was bad, who knew the diet was bad, asked the hospital director to shut down our first study, and we didn't. We were forced to make more reports so that we weren't killing anybody. Of course, we weren't killing anybody, but so the fear about keto diets can be quite strong, and even to the point that people are scared to try it because if there's one person who says it's controversial, that can make some people shy away from it. Well, I can just explain that there will always be someone to say that it's controversial. I mean, that's just the way the diet world is. But for me, over the last 20 years now, since our first research study, I've used the same approach that we used in our studies. It's very similar to the Atkins approach in my own clinic at Duke University now for 15 years. And I have to say I'm practicing the best internal medicine that I ever have. My best internal medicine is the treatment of chronic illness or prevention of chronic illness like diabetes, high blood pressure, these things. And I get to treat these things and fix them now, reverse them, rather than just manage them. So it's pretty amazing. But yes, we started with some studies that were controversial at the time. They're still controversial today, but the research has been validated or replicated all over the world. So it's not just our group anymore. But at first it was kind of lonely, if you will, to be the only person looking at this in a research setting.
Thank you so much, Eric. Eric, why is the current approach to diet and health is failing?
Well, the easy answer for me is carbohydrates. The more complicated answer is too much food, which includes fats, proteins, and carbohydrates. So in areas where there isn't a whole lot of access to food generally, we don't see the same chronic illnesses. There's not the obesity and diabetes in areas where there's not a whole lot of food. So the easy answer, though, for me, when I teach this approach, is that if you cut out carbohydrates, the hunger normalizes. The hunger goes away, or I say normalize. You see, you were having too much hunger to begin with, but you wouldn't know that until you stopped eating the carbohydrates. So, especially with diabetes, it's the carbohydrates. It's sugar in the food and drink that raises the blood sugar. I mean, that's not rocket science. That should be obvious. So the idea that there are too many carbs, too many, scientifically speaking, it's too many calories and energy, but it's difficult to teach a low energy diet for a long term. That's why I gravitate, why I teach the keto diet, because the hunger goes away. It's much easier to do in the long term.
Thank you, Eric. Eric, before 1900s, many doctors knew about low carb diets, but after 1900s, why did many people forgot about that?
Yeah, that I trained in the U.S. in the 1980s, and I didn't know anything about diet. They don't train medical doctors about nutrition or how to help people lose weight. So I learned about the history of the keto diet from a patient of mine. A patient of mine was a bookstore owner, a used bookstore owner, and she knew I liked history. That was my undergraduate major, was history. And so she brought me this book from 1923. And I was reading this book, and I wondered what they did for diet back then. This was 80 years before, right? I'm reading this about 1998. And sure enough, the low carb keto diet is in this book from 1923 as a treatment for diabetes. So all of the doctors, it got me interested. So I did some research about the diets being used around 1880, 1900, 1910, 1920 in the Western world. I can only read English, so this may be available in other languages, other cultures. I'm afraid I'm very English-centric, but at least in the European, Canadian, U.S. world, the low-carb diet was understood to be the treatment because there were no drugs, there was no insulin. The only treatment people had was changing the food and the drink. And it turned out that it was very effective. And now over time, what happened is it's a hard story to get at because no one came out and said, that people are going to be better eating carbs and using insulin because there's no science that says that. So actually, there never has been a study of the old low-carb diet or the diet that I use today versus the eat all the carbs you want and just take medication. And there's been no study comparing the two. It's a study I want to be involved in and help with because I'm very confident that the study will show that changing the food is much better because we can fix it. So I see in my office, in my clinic, the reality that goes way beyond the published literature, which is a problem, I know, because a lot of people won't believe it unless there's a study about it. But what happened is that medications became used for diabetes. And the medications for diabetes can make you get fat, can cause obesity. And then the obesity makes the diabetes worse through something called insulin resistance. So once you start down the medication pathway for managing diabetes, you're always going to have diabetes, which is good for the drug industry, good for the drug companies, not so good for the individual. So what happened was, at least in the US, it's pretty clear. The guidelines from the government said to eat carbs and that's because America makes a lot of carbs, a lot of wheat and corn, and so the mainstream teaching of eating high carbs, we had something called a food pyramid. I hope it didn't get to India. I think it probably did, because what happened is all the guidelines came from the US and then were sent worldwide. After a 10-year period, all the other governments started promoting this diet that had no science behind it. So it's a sad story. You know, it's a story that's told in 2 books that I highly recommend for a deep understanding of this. Gary Taub's Good Calories, Bad Calories, and Nina Teicholz's The Big Fat Surprise. They talk through the history of all of this. And so I find today that I teach about the history of this to help people understand it's safe. It's been around a long time. It's just that it was lost from the medical community.
Thank you, Eric. Eric, how to find our personal carbohydrate threshold?
There's several ways. So the carbohydrate threshold is a term that's used that, you know, when you think about it, it's when was the food so available that we would be able to eat every day, 3-5 times a day, and the same amount every day. So I don't think you have to have the same amount every day. I think variability is fine. But individuals, based on their genetics, their metabolism, some people can tolerate or metabolize carbohydrates better than others. But the interesting thing is that it was a preferred metabolism that if you ate any extra carbohydrate or food, you would store it as fat. So these people would live during a famine if there was a famine. But now we've been fortunate to not have widespread famine for so long. The problem now is eating too much and going over this carbohydrate threshold. So we find that 2 ways of thinking of it. One is, what's the threshold to get ketosis? That's something that's measurable in the blood, the breath, the urine. But there's also a carbohydrate threshold that just is for general health. So I don't know that you have to be in ketosis all the time to measure it. So we have, in the new book, End Your Carb Confusion, we have a simple checklist, a table where you can figure out what carbohydrate level we think would be best for you. And that's a general, we think, because the only way to know is to try it and to see if that threshold, that amount of carbs, doesn't make you gain weight, doesn't make your blood sugar go up. But you know, I have a brother who can eat more carbohydrates than me. And so even within the same family, you can have these differences in metabolism. And that's because we come from parents, and the genetics get mixed. That carbohydrate threshold is something that's different for different people. I find that if I get the carbohydrates under about 20 to 30 total grams per day, that's below everyone's carbohydrate threshold. That's why I teach that at first in a clinical setting. I use keto, that keto metabolism, because it's very powerful. It's very strong. It has a drug-like effect. But the carbohydrate threshold varies from person to person.
Thank you, Eric. Eric, why anecdotes are more important than epidemiological studies?
Well, anecdotes are important. They have limitations, of course. But the problem with waiting for studies to be done in this area is that the people who give money to do the studies don't think this is a valid area of research. So it's very, it takes time, the skill to know how to do research, and then the money to do the research program. And I was in that world. I know how to write my own grants. I know how to apply for grants. And we were funded by Dr. Atkins, and then the Atkins Foundation, and then the Veterans Affairs Hospital in the US. It's a little easier to get those grants. But the NIH, the National Institutes of Health, in the U.S. has been very reluctant, and it's a paradigm shift, meaning the people who are approving the grants don't think this is valid to study. So even though you submit a grant, if the reviewer that reviews the grant says this is not worthy, then you won't get the research funding. So what we see is a very interesting development with GoFundMe and with the people funding their own research, giving $5, $10 here and there. It's been exciting to see several low-carb keto groups get together and fund their own studies, because the medical mainstream would just say, don't do it. They wouldn't say, okay, it's interesting, let's study it. They just tell you, don't do it. So I've been pretty disappointed in our research funding process. The established researchers don't think this is an area that is worthy of research. Of course, they haven't solved the problems themselves, which it kind of also, though, you have to understand that a researcher sometimes is very cynically, we think a researcher doesn't really want to solve the problem, because then there's no more research to do. So that's the reason why I think research can go on without fixing the problem, because if they fix the problem, then there's no more research. But I have to think that it's more the fear of fat, the idea that we were all taught eating fat was bad and unhealthy, and we know now that that's not true. It's just the people who were taught that, sometimes it's very difficult to teach them something new.
Thank you, Eric. Eric, do low-carb diets damage our organs?
Do they damage our organs? I mean, like heart and lungs and liver and intestines and brain? No. A low-carb keto diet, as long as it's done correctly, is a very healthy thing to do. I think it's healthy for anyone, any age. You can't be too young. In fact, children are born in ketosis, which was a shock to many people. But the obstetrics world, or if you're a pediatrician in the neonatal ICU, and you know this, this is measurable, and it's like common knowledge. And then older people, you have to get away from the term keto and worry that it's just real food. So depending how you learn how to do it, there are some new keto products, keto shakes and pills and oils, and I don't teach it that way. I teach it using real food, just keeping the carbohydrates really low. And so whether it's meat-based or vegetarian-based, it's fine. You just want to keep the sugars and refined starches especially as low as you can.
Thank you, Eric. Eric, can we reverse PCOS?
So PCOS is a condition that causes infertility in many women, polycystic ovarian syndrome, and that gets better on a keto diet. And we published a paper now over 10 years ago where several of the women actually became pregnant in our study. Fortunately, they wanted to. So we actually warn young women who can become pregnant that they have to be careful, because many people with PCOS don't have menstrual cycles anymore. They don't ovulate, they can't get pregnant. And so when you change the diet, it doesn't take long. Maybe even within the first month or two, the diet changes the hormones so that you can start having ovulation or an egg produced, and you can become fertile and have a baby. So if you don't want to be pregnant, you have to use contraception or be very careful about that. The sad reality is, in my area even, these women will go, or the couples will go to a fertility center, and the center will try drugs and will try in vitro fertilization and all of these very complicated, invasive things, and then they don't have success. And then the doctor says, well, why don't you do something about your weight? And so the women come to me, they have PCOS and weight to lose, I put them on a keto diet, and then many times they become pregnant within the first month or two. And, just last week, I got an email that, Dr. Westman, I'm pregnant. Thank you so much. So often all I do is teach people how to do this, and then I don't see them frequently if they know how to do it. It's sort of like learning to ride a bike or a skateboard or something. Once you learn how to do it, you don't need the coach anymore, right? In fact, I remember the look in my children's eyes once they learned to ride a bike. They were gone. They didn't need me, the teacher. So a lot of people, like in your case, just need the knowledge, and it can be easy to do. And with the hunger going away, and with conditions like PCOS and diabetes, high blood pressure getting better, I use this as the first treatment for all of these conditions in my keto medicine clinic.
Thank you so much, Eric, for sharing that. Eric, what is your most memorable testimonial?
Oh, well, I've helped a lot of people lose weight, hundreds of pounds in a given individual. And that, it's a slow process, meaning that it may take several years for this to happen. But for someone who's going through it, it's exciting, and at least they know the weight is coming down. And so the weight loss is kind of like I'm used to that. And, but doc, I can, change. I need new shoes, the smaller ones, and I need new clothes. That's great. But I've advanced sort of into the other conditions that can get better. And probably the most remarkable case that I had personally was someone with severe mental illness. It's a condition called schizophrenia, where you're fraught with these voices, and in this case, the voices told her to kill her husband, to kill her babies, and just a terrible, terrible story of how it affected her. And within 2 weeks on the keto diet, it was all gone. And she was in her 60s, so that she, there are conditions that can be lifelong, and that if you've always eaten carbohydrates, it may be that carbohydrate was the cause of the disease. So I have dramatic stories of obesity going away, diabetes going away, high blood pressure. I've taken people off 10 medicines that they've needed or used for those conditions. And of course, I do this as a trained doctor who knows how to handle these medicines and these medical conditions. Another extreme case is we have a lot of people now who have heart failure, and their heart is so bad that they need a heart transplant. And yet the patient, the people are too heavy for the surgeons to operate on them. So they send the patients to me because I don't use drugs, I don't use surgery, all I do is change the food. And so it's very rewarding to help someone get a new heart. So it's like I'm now part of a team at a university where if someone needs new hips, new knees, they send them to me. I help them lose the weight so they can get those things, a new heart, a new liver, a new kidney. I mean, there's so many things that we can help, but I still enjoy hearing every story of weight loss, even though that has become very common. It's just I've always enjoyed working with people and seeing them get better, and that's still very rewarding for me as a doctor.
You're so awesome, Eric. Thank you for that. Eric, what do you say to the people who say that our grandparents and parents ate lots of carbs? They did not face any problems until they were age 70 or 80. What do you say to such people?
Yeah, well, I think there are many ways to be healthy, and we can explain that by different carbohydrate thresholds, and also the type of food that was eaten. So the type of food, if you can stay to generally real food, not a whole lot of processed fake foods, the candies, the food that comes in a box and a bag, and I think you can be healthy. Now, living to 80s and 90s is all well and good, but what if you could add 10 more years? So you'll never know going, because you can't go back. But what we see is that the sugar and the insulin in any animal or even worm, for that matter, the more insulin you have, the more aging you have. The more insulin you have, the less long you live. You have a shorter lifespan. So I think, yeah, it's people can be healthy and eat carbs. It reminds me of when a patient tells me, well, my parents smoked and they lived till they were 100. Well, some people get away with it, but on average, on balance, cigarette smoking is not healthy to do. If you're one of the ones who have emphysema and then can't breathe because of the cigarettes, so why take that risk? But I think I have to admit that there are lots of ways to be healthy and to be total meatitarian. No, I think you can be vegetarian. It's a little harder to be strict vegetarian or vegan because you have to worry about nutritional things like B12 and all that. I find it's more nutritious. I worry less if someone's eating meat on a keto diet because the nutrition, the vitamins and minerals are better in these foods. But there are many ways to do it, and yeah, you can be healthy and eat carbs. I mean, that's kind of the reality. I'm not convinced yet that a keto diet is better for everyone. Don't get me wrong. I'm still eyes wide open. I look at research that other people do. I know that we are best known for our keto research, but I also read other people's research.
Thank you so much, Eric. Eric, what is your opinion on fruits and fruit juices?
Well, fruit and fruit juices have a lot of sugar in them. And the sucrose, fructose, glucose, the combination of all these things raise the blood sugar. So if you have diabetes or a metabolic problem or overweight, obesity, you don't want to have much fruit or fruit juice. For a while in my clinic room, I had a picture that said fruit makes you fat. And then people would come in and it shocked too many people, so I took it down. But another thing you can do, you don't have to believe me, you can check your blood sugar 1 hour after you have fruit juice or fruit, and you'll see, even half a banana is going to raise your blood sugar, depending on the size of the banana. Yeah, fruit and fruit juice are not good if you have obesity or diabetes.
Thank you, Eric. Eric, can you talk about total carbs versus net carbs?
Yes, this is a common source of confusion today, the total carbs versus net carbs. And the idea of net carbs came in rather recently. So to give you some context or history, the idea of counting carbs started with counting total carbs. The idea is that any carb, even if it's fiber or fits in that category, can impact the blood sugar and metabolism. So around the year 2000, there were several companies, several doctors who decided to come up with the idea of net carbs. It's based on the theory that the fiber grams don't get absorbed, so you can subtract them, take them away, and that the sugar alcohols don't impact the blood sugar, so you can take them away from the calculation. And it also allowed companies to make more products, because it's difficult to make products to stay on the shelf very long if they have low total carbs. So the idea is relatively new, and the doctors who use a low carb diet clinically, like I do as a prescription strength, we use total carbs, not net carbs. So I know a lot of people have benefit with net carbs, but if net carbs isn't working for you, then don't give up and say, oh, keto doesn't work for me. try the total carb method and the way of doing it, because I've had many people stop having success by using net carbs, and then I teach them total carbs and they start having success again. So that's a big difference between total carbs and net carbs. It's the how powerful it is. Net carbs is not as powerful as total carbs.
Thank you so much, Eric. Eric, what mistakes people do on a keto diet?
Well, the mistakes, meaning things that make it so it doesn't work well, right? I think, if you, the interesting thing about a keto diet is you can do it sort of wrong or do it every now and then and it will still work because it's so important to get rid of the sugars and starches. But we do teach it as something you'll want to do every day. And we teach it for people who want to lose weight or fix diabetes, reverse diabetes. So one of the most common mistakes is not to do it every day. People will come to me and it's kind of, when it comes to diet, sometimes people just lose their minds. If I told you to take this pill every day for a month and come back to see me, the people wouldn't come back and say, well, I only took half the pill. Or, I only took the pill every other day. Or, can I take only half a pill every other? So with diet, no. So like a prescription drug, the way we teach it, it works. But you have to take it. You have to do it every day. So I think the most common mistake I see now is the idea of a cheat meal, or every now and then you can have carbs. It resets your, no. The best thing is just to stay really strict, get the keto metabolism, the fat burning metabolism to work for you. But after the having to do it every day, then the most common things I see people do that make it not work is adding too many oils and butter or ghee into coffee, things like that. When we studied this for weight loss, we didn't use butter in the coffee. That wasn't part of our program. In fact, I don't know of any study where they've used something with butter in the coffee and then having multiple throughout the day. It's not a weight loss plan. So if you're trying to lose weight, you don't want to be drinking lots of oils and butters, and you don't want to drink a lot of calories. It's the bottom line. So the main two issues I see are people overconsume the fats and the oils, the butter, because it makes sense because they tell me, well, it's zero carbs. And I thought it was all about zero carb. Well, it is zero carbs, but you have to be very careful with the high calorie foods as well. And so the way we teach it, there's a limit to the cheese, the oils, the butter, so that you don't overconsume the calories. But those are the two most common mistakes I see. Adding too much oil, meaning calories and energy, and then the total versus net carbs. So going to total carbs and limiting the fats and oils, and even nuts sometimes can make it work. Nuts for a lot of people are a trigger food, meaning it triggers your hunger and you can't stop eating the nuts. Have you ever had that happen to you? Yeah, it's pretty common. So.
Thank you, Eric. Eric, how to cure type 2 diabetes?
Well, we know that type 2 diabetes, if weight is a contributor, so if you have obesity and type 2 diabetes, any way to lose the weight will help and reverse the diabetes. So if you go for weight loss surgery, you can reverse diabetes. If you use medication to fix the obesity, you can fix diabetes. If you use lifestyle, like a keto diet, you can fix diabetes, because you're treating the underlying cause of the diabetes, which is the food and the insulin resistance from the obesity. So that is why many programs don't know about this. Other kinds of diets are not as powerful, so most doctors don't think diets can do it. But the keto kind of diet is prescription strength. And fortunately, our study on diabetes was published in 2008, and you can research it. But it was only about 50 people over 6 months, and a lot of people look at that and say, well, that's not good enough. Well, fortunately, recently there was a new study done by a company called Virta Health, and they have hundreds of people, and in there they have documented case after case of reversal of diabetes. Of course, doctors who've been using this for the last 50 years know in our clinics we've seen that all along. It's just a lot of people don't believe it until it gets into the research world. That's the idea of anecdotes. A lot of doctors think anecdotes don't count, but if you have 1,000 anecdotes, suddenly you have information that it's difficult to ignore.
Thank you, Eric. Eric, how can a layman can understand what is a real research or real science?
Yeah, that's a great question. You would think that the journal itself would tell you that this is a good journal, it's a good paper. That's sadly not the case. So I trained for several years to learn how to look at studies and to make sure that they were excellent. And it's not easy. So I guess if you don't have background in the science, you want to learn from a trusted source. Someone who comes to mind worldwide who's been very helpful is a woman named Zoe Harcum. Zoe is in the UK, and she does some excellent, deep reviews of research. Now, that might be too much for you. Another source that I use is dietdoctor.com internationally, because they review papers but don't give, Zoe does a deep review of all of them, so scientifically. But you have to be careful. I'm afraid the mainstream medical literature is not a good source today, because there just aren't a lot of studies on the keto diet and studies done by researchers who don't come in already biased against the keto diet. It's sad to see that you might even see the result in the paper being a good result, but the abstract or the conclusion says it's bad. And it's just, so 25 things can get better, but they'll focus on the one thing that doesn't. And then, so if all you do is read the abstract, the summary or the conclusion, it'll say don't do it. When you read the paper inside, it was an excellent positive study. So that's a great question. I think there are some Reddit resources, and I don't know exactly all of them. I know the Public Health Collaboration of the UK has a list and summary tables and things like that, if you want to have access to that information.
Thank you so much, Eric. Eric, now we have questions from subscribers. First question is, can people without gallbladder do a keto diet?
Yes. No problem.
Okay. Thank you, Eric. Eric, second question is, can we do a keto diet long term?
Yes. As long as you're doing it in a way that you've been taught correctly. So really, on a keto diet, or for any nutritional program for that matter, protein is the most important thing, not ketones, not fat. So if you get taught the correct way, you're eating real foods. This is healthy eating for anyone. There are more studies now for longer periods of time on low carb keto diets than any other diet. So if someone says, oh, there are no long-term studies, that's not true. They just haven't looked, or they don't want to know. So yes, you can do it long-term.
Thank you, Eric. Eric, next question is how to deal with arthritis.
Well, interesting. A lot of people tell me their arthritis gets better when they do a keto diet. And what's fascinating, it doesn't even have to take much weight loss. So we think that it's the carbohydrates, the sugars, and the insulin going up from the sugar that raises inflammation in the body. And that inflammation causes joint pains and arthritis. So unless it's a very severe case, so there's always a possibility there's permanent damage with any of these diseases, and same with arthritis. But if it's a reversible sort of arthritis, I've seen people improve, even cases of rheumatoid arthritis, where the hands become all inflamed and you can't see the knuckles anymore. and that's at the anecdotal level, but I've never seen any other lifestyle approach fix rheumatoid arthritis. A lot of doctors who do operations for joints, the knee replacements, the hip replacements, will put people on a keto diet, and then the people don't need the joint replacement anymore. And in our area, there's so many people that need them. There's plenty of business. They're not sad because there's still a lot of operations to do. But yeah, arthritis can improve, and joint pains typically improve.
Thank you, Eric. Eric, next question is, there are many health experts with different opinions. For example, some says low fat is good, but some says low carb is good. Whom to trust, and are there any proofs for low carb diets?
So the research that we've done was mainly on low carb diets, but in our studies we would compare low carb diets to low fat diets. Yeah, they can work. So the people who say there's only one way, it's kind of like going to the car salesman. Of course, there's only one car that can be sold on their lot, right? One brand. And then you go to the next car lot, the next car salesman, and it's a different car. So once you get into the salesmanship of diets, you'll hear people say, oh, that doesn't work, or that, but the science says all of them work. I mean, all the cars drive just fine. Now, you could argue that ours is safer, or ours is easier to do, but when you hear someone say that low carb doesn't work, they're being a salesman. Or if they say low carb is dangerous, then they're being a salesman. They're trying to get you not to do that. They're trying to get you to do their diet. So I'm very careful with my language to say that all of these different approaches can work. Do the one that works for you, and then also don't be satisfied with programs that don't work. You know, if you try something for 2 weeks and it's not working, you try something new. And you will see, eventually you'll probably, if you have carbohydrate intolerance, you'll eventually get to a low carb diet, because that's what really works if you have carbohydrate intolerance. So, you know, in my area at Duke University, Durham, North Carolina, we have many different programs. Some are low carb, some are low fat, some are surgical based, some are residential, where you come and you stay a month. Can you imagine? I mean, yeah, there are some people who come and stay for a month in a program. They need that much help. So now it's not cheap. Sadly, it's very expensive to do that. But so keep in mind the salesmanship. Is this person just trying to sell me, or are they really talking about the science?
Thank you so much, Eric. Last question. Would you like to issue a 7-day challenge to our subscribers?
Sure. A 7-day challenge to see if your hunger goes away. That will be the test, so, or greatly diminished. And if that's true, then maybe everything else we've said is true, because that's the first thing that will happen. Now, it works for just about everyone. There are a few instances where it might not work. If you're on medication, you have to realize that be careful. The medicines need to be monitored, especially diabetes and high blood pressure medicines. There are times when someone's on insulin or prednisone, steroid medicines, things like that, where it might not work, but for nothing will work for that matter. But yeah, the 1-week challenge is a good one, because even then I will negotiate. If someone, oh, I don't know, I said, look, just do it 1 day. Or do it 2 days. Or the first day, if it's okay, do it the second day. But a week, yeah, you'll be convinced. But sometimes I even have to negotiate compromise for the 1 day. Because, you know, I understand. I've had bread all my life. I've always had sugar. It's okay. You don't need those foods. Your body will start running on fat. The hunger goes away. It's pretty amazing. And in fact, Diet Doctor, I know Dr. Ian Felt very well. He pulled out one of my quotes some years ago. It says, Dr. Westman says, it's so unbelievable, people don't believe it. And that's true. Or, you know, I hear people say, oh, if anything's too good, it can't be true. Well, in this case, it is true. So it kind of it's interesting because it's so different from what we're used to. Sometimes people are shy. Some people can't believe that it really does work. But once you find that it works, it becomes infectious, doesn't it? And you want to tell other people and spread the word about it.
Thank you so much, Eric. Thank you so much, Eric, for coming to the show and helping us to become healthy.
My pleasure. Anytime.
Thank you.
Subscribe to BNS Goku Great.